The human heart is a strong, muscular organ that works continuously from the moment we are born until the end of life. The main job of the heart is to pump blood, which carries oxygen and nutrients to all parts of the body and removes waste products. When the heart is healthy, this process happens smoothly. But when the heart is affected by disease, this blood supply becomes disturbed and the entire body can suffer. Now, heart disease is not just one illness. It is a group of different conditions that affect how the heart works. In this video, we will clearly explain every major type of heart disease, so let's begin. Coronary artery disease is the most common type of heart disease. The heart muscle receives oxygen-rich blood through vessels called coronary arteries. Over time, fatty substances such as cholesterol, calcium, and waste products begin to deposit on the inner walls of these arteries. This process is medically known as atherosclerosis. The deposits, called atherosclerotic plaques, slowly narrow the arteries and reduce blood flow to the heart muscle. As blood flow becomes limited, the heart may not receive enough oxygen, especially during physical activity or stress. This condition is called myocardial ischemia, and it often causes chest pain or discomfort known as angina pectoris. If an atherosclerotic plaque suddenly ruptures and a blood clot forms, the artery may become completely blocked, leading to a heart attack. A heart attack, medically called myocardial infarction, occurs when blood flow through a coronary artery stops suddenly. This usually happens due to the rupture of an atherosclerotic plaque, followed by the formation of a thrombus, or blood clot. When the heart muscle does not receive oxygen, the affected part of the muscle begins to die, a process known as myocardial necrosis. Symptoms of a heart attack may include chest pain or pressure, pain spreading to the left arm, neck, or jaw, shortness of breath, sweating, nausea, and weakness. A heart attack is a medical emergency, and immediate treatment is critical to restore blood flow and reduce permanent damage to the heart. Heart failure, medically called congestive heart failure, does not mean the heart has stopped beating. It means the heart is unable to pump enough blood to meet the body's needs. This may happen because the heart muscle becomes weak, stiff, or damaged. As pumping efficiency decreases, blood can back up into the lungs, causing fluid accumulation known as pulmonary congestion, and into the legs and feet, causing swelling called peripheral edema. Common symptoms include shortness of breath, fatigue, and swelling of the lower limbs. Heart failure often develops as a long-term result of conditions such as coronary artery disease, high blood pressure, or previous heart attacks. Arrhythmia refers to an abnormal heart rhythm caused by problems in the heart's electrical system. The electrical impulses that control the heartbeat may become irregular, leading to a heart rate that is too fast, called tachycardia, too slow, called bradycardia, or irregular. One of the most common arrhythmias is atrial fibrillation, where the upper chambers of the heart beat in an uncoordinated manner. Arrhythmias may cause palpitations, dizziness, fainting, or sometimes no symptoms at all. Certain arrhythmias increase the risk of blood clots and stroke if left untreated. The heart contains 4 valves that act like one-way doors. These valves open and close to ensure blood flows in the correct direction. Heart valve disease, medically known as valvular heart disease, occurs when one or more of these valves do not function properly. When a valve becomes narrowed and does not open fully, the condition is called valvular stenosis. When a valve does not close properly and allows blood to leak backward, it is called valvular regurgitation. Valve problems force the heart to work harder to pump blood, leading to symptoms such as fatigue, shortness of breath, chest discomfort, and dizziness. Valve disease may develop due to aging, infections, congenital defects, or rheumatic fever. Congenital heart disease refers to heart abnormalities present from birth. These conditions occur due to improper development of the heart during pregnancy. Examples include septal defects, which are holes in the heart walls, abnormal valves, or incorrectly connected blood vessels. Some congenital defects are mild, while others are severe and require surgical correction early in life. Cardiomyopathy is a disease that affects the heart muscle, medically called the myocardium. In this condition, the heart muscle becomes abnormal, making it harder for the heart to pump blood effectively. There are three main types of cardiomyopathy. Dilated cardiomyopathy occurs when the heart chambers, especially the left ventricle, become enlarged and stretched. This weakens the heart's pumping ability, causing fatigue, shortness of breath, and heart failure. Hypertrophic cardiomyopathy happens when the heart muscle becomes abnormally thick, reducing the space inside the heart and making it difficult for blood to flow out properly. This type is often inherited and can cause chest pain, dizziness, or sudden collapse during exertion. Restrictive cardiomyopathy is the least common type and occurs when the heart muscle becomes stiff and rigid. Although the heart size may remain normal, it cannot relax properly between beats, preventing adequate filling with blood. Over time, all forms of cardiomyopathy can lead to heart failure or dangerous heart rhythm problems if not managed properly. Hypertensive heart disease develops due to long-standing hypertension or high blood pressure. When blood pressure remains high, the heart must pump with greater force, causing thickening of the heart muscle, a condition called left ventricular hypertrophy. Over time, this leads to reduced pumping ability and increases the risk of heart failure, coronary artery disease, and stroke. Inflammation is the body's natural defense response to injury or infection. When any part of the body becomes inflamed, it becomes swollen, irritated, and sometimes painful because extra blood and immune cells rush to that area to fight the problem. While inflammation is meant to protect the body, it can cause harm when it affects vital organs like the heart. In inflammatory heart diseases, this immune response targets parts of the heart. When the heart muscle itself becomes inflamed, the condition is called myocarditis, which is often caused by viral infections. When inflammation affects the thin protective sac surrounding the heart, called the pericardium, the condition is known as pericarditis. These conditions may cause chest pain, fever, fatigue, and shortness of breath. In many cases, they resolve with proper treatment, but severe inflammation can weaken the heart and lead to long-term complications. In many parts of the world, especially where access to healthcare is limited, rheumatic heart disease remains common. This disease develops as a result of untreated throat infections caused by group A streptococcus bacteria. The infection can lead to rheumatic fever, which damages the heart valves over time. This condition is preventable with early antibiotic treatment, but once valve damage occurs, long-term medical care or surgery may be required. So, these were the major types of heart diseases. This video was meant as a simple overview, not a deep dive. In upcoming videos on Pulsepedia, I will explain each of these conditions in detail, along with topics such as heart anatomy and how the heart works, all explained in easy language. If there is any heart-related topic you would like to see next, share your suggestions in the comments. This is Pulsepedia, your guide to the human heart.